My name is Lou Rice. I'm the chair of the Department of Medicine at the Warren Alpert Medical School of Brown University and the president of Brown Medicine. I'm here with my colleague, Dr. Angela Caliendo, the executive vice chair of the Department of Medicine and the president of Brown Physicians Incorporated. And our goal today is to inform you as much as we can about the information that is now available about the types of vaccines that are likely to be delivered over the next few weeks here in Rhode Island. There will be two vaccines that will be generally available in the state of Rhode Island within the next few weeks. One is manufactured by Pfizer, another is manufactured by Moderna. Both are quite similar. They're both what are known as RNA vaccines. And put simply, these are vaccines that are made of genetic material called RNA, ribonucleic acid, which is the messenger for making proteins. This RNA is encased in a lipid formulation that allows human cells to take it up. And this then uses the human cell machinery to manufacture the viral protein called the spike protein, which is the protein it uses to enter human cells. Only there's a couple of amino acids in this protein that have been changed so that won't happen. But still, our immune system will see this protein and generate antibodies to it. And over time, we will develop protective immunity against the SARS-CoV-2 virus. The clinical studies show that this vaccine, despite the fact that this is really the first example of a vaccine like this that has made it into a point where it's going to be delivered to humans, it actually works quite well. 95% protection is what is listed and was just recently published yesterday in the New England Journal of Medicine for the Pfizer vaccine. The preliminary data for the Moderna vaccine also suggests that it is 95% protective. It does require 2 doses, the Pfizer vaccine 3 weeks apart, the Moderna vaccine 4 weeks apart. But protection actually begins to a substantial degree, at least in the Pfizer data, about 10 days after the first dose. That's where you see the curves separate and many more infections occurring in patients who got placebo. To give you an idea of the difference, of the 44,000 people who got the vaccine, half getting the vaccine and half getting placebo, in other words, something that is not active medically, there were 162 cases in the people who got placebo compared to 8 cases in the people who got the vaccine. Of the 10 or 11 cases that were serious, only 1 was in the vaccinated patients.
So there's been a lot of interest in having information around the safety of these vaccines. As Lou pointed out, this is the first time that we've had RNA vaccines massively deployed in this country. And so we have data from both of the clinical trials. The good news is there are very few serious side effects from either of these 2 vaccines. What we do see quite commonly are what we would refer to as mild or moderate symptoms. So these are things like soreness at the site of injection. That occurs in almost 75% of people that take the vaccine. Some people get a substantial amount of fatigue, some achiness of your muscles, some chills, fever. So these are quite common. Some of the more common ones like headache and fatigue can occur in as many as 30 to 40% of people receiving the vaccine. Fever is less common, more in the range of 5 to 10% of people that receive the vaccine. We do not have any really substantial information on either pregnant women or breastfeeding women. This is something that the CDC is hoping that they will see sooner rather than later, hopefully in the upcoming months. But right now there are very limited data to help guide women of childbearing age regarding taking the vaccine. So what we know from the data from the clinical trials is that younger people are more likely to have these side effects, likely because they have a more robust immune response to the virus. And also you're more likely to see these symptoms on the second dose compared to the first dose. These symptoms that people have after they receive the vaccine last for about 24 hours. And on the second dose, they may last for 48 hours. And so they're relatively short-lived. So certainly the risks associated with the vaccine are actually quite mild, and the value of preventing COVID infection is substantial. So overall, the benefit of the vaccine far outweighs the risk associated with the vaccine. One of the questions is, what can you do about these side effects if you develop them? You could take some Tylenol, you could take some ibuprofen. That was allowed in both of the vaccine trials, both the Pfizer and the Moderna vaccine trial, and it seemed to help people through these relatively mild symptoms. You may have heard about the 2 cases of anaphylaxis in the UK. They started vaccinating this week, and 2 healthcare workers developed anaphylaxis, which is a severe allergic reaction to the vaccine. Both of these people had a history of severe allergic reactions. They carried EpiPens to prevent this type of reaction. So these types of individuals, those with a history of anaphylaxis, were not enrolled in the clinical trials. They were actively excluded. So we don't have a lot of information on how often this side effect will occur in people with severe allergies, but they certainly in the clinical trials did not see this type of reaction in people that do not have a history of anaphylaxis.
There is a lot of concern among people that vaccines can give you the disease. And the answer to whether that's true is, well, it's pretty clear here. But this really comes from the fact that a lot of original vaccines were viruses themselves that had just been attenuated or changed in some way, in some cases not even knowing how it was changed, that made them no longer quite so what's called virulent. In other words, they could infect people, cause an immune response, but not cause a disease. As I said before, this is an RNA vaccine. So it doesn't have the viral coat. It doesn't have the genetic material even to make the virus coat. All it is injecting the RNA, which is the message to make this one protein. And this one protein is not a virus. It's just a protein that will engender an immune response that will then allow the body to attack the virus before it can take hold in the body. So the simple answer is that you cannot get infected with SARS-CoV-2 by this vaccine, period. That won't happen. You can, as Dr. Caliendo said, you can feel pretty ill from the vaccine. A lot of the illness that's felt with viral diseases has to do with the immune reaction to the virus. So you can, for a day or two, have fevers, you can have muscle aches, you can be fatigued. So there is, if you want to call that an illness, there is some potential illness associated with it, but it is not COVID-19. You cannot get COVID-19 from this vaccine.
The vaccine has recently received the emergency use authorization coordinated by the Department of Health. So they have set up phases, phase 1, 2, 3, and 4. And then all the hospitals in the state and all the practices in the state will go by the guidelines that the Department of Health has set up. So first phase will be healthcare providers, as well as first responders, and people with severe comorbidities, and residents of long-term care facilities. So that's phase 1. Now, we don't have enough vaccine initially to immunize everybody in phase 1. So even in the phase 1 group, there's going to be a gradual grouping of who gets vaccinated depending on your level of risk. So for instance, if you look at physicians or staff in our hospitals, those that are taking care of COVID patients on what we call our warm units will be the first to get the vaccine. Once those group is all vaccinated, they'll move down the line, both nurses, staff, and healthcare workers. It's going to take a month or 2 to get all of phase 1 immunized, and then we'll be moving into phase 2 sometime in January would be my guess. The second phase of the vaccine deployment is going to be people that are educators, people that are considered essential workers, so people in grocery stores. Older adults are also in that group. People that live in congregate settings, so prisoners, homeless shelters, they will also be in phase 2. And then phase 3 is anyone else that's working and those that are out in the workforce but do not fall in phase 1 or phase 2. And then finally, the last phase will be everybody else that we haven't mentioned above. Some of the logistics around administering the vaccine are going to be, don't immunize all of the physicians in one area or one practice on the same day, or don't immunize all the physicians and staff on one day in a practice. A third of them may be out the next day and unable to work. And so a couple recommendations are, it's ideal to take the vaccine the day prior to a day off. Now that may be possible, it may not be possible. If that's not possible, then you need to look within the group and stagger the vaccinations so that maybe some of people, let's just say in the intensive care unit, physicians and nurses, you might immunize some on one day, wait 3 or 4 days, make sure everybody's okay and back to work, and then you immunize another small group of them and continue working down the line in a staggered way so that you don't have a large percentage of your workforce out on any given day. One thing I think that we all have to appreciate is the vaccine is here. People are very excited about taking the vaccine. We just don't have enough of it right now to immunize everybody. So we're going to have to go through this risk phase. We will eventually get everybody vaccinated. It will take a couple of months, but we have to be mindful of the structure that the Department of Health has put into place. If you look at the people that have already been infected in the state that have likely still have some immunity, and the people that we're vaccinating, once that group totals around 60–70% of the population, you really do start developing a substantial amount of herd immunity.
I think one thing that's important to keep in mind is that the study that was done on the Pfizer vaccine, which is what we have in the published literature now, did not assess people for what's called asymptomatic infection. Now, those of you who read about COVID know that as many as half the people who get infected with COVID don't have any symptoms. And that's one of the big problems because they're out there thinking they have no trouble and they're spreading the infection to other people. We don't know whether or not a number of people who got the vaccine, maybe even a substantial number, actually have the virus in their respiratory tract but have no symptoms. It may be that the vaccine prevents the disease, but doesn't necessarily prevent you from having it within you, which means it may not prevent you from spreading it. Until we know whether the vaccine will prevent that sort of colonization of your respiratory tract, it's extraordinarily important for everybody to continue to wear masks. You may feel safe, although you're not completely safe because it's only 95% protective, so there's still a 1 in 20 chance that you might actually get it even though you have the vaccine. You may feel very safe, but you may not be safe for other people. It's really important that we wear masks now that the virus is really rampant in the community. And it's very important that we continue to wear masks for some period of time afterwards, for 2 reasons. One, you can still get infected with COVID if you have been vaccinated. That's what the data shows. It's 95% protected. That's not 100%. And the other is we just don't know whether you'll still be able to spread it if you happen to be asymptomatically infected. So think of yourself, protecting yourself, and think of everybody else. Think of the other people you might be infecting. Keep wearing the mask, keep social distancing. We all want society to open up. Desperate for all those poor people who are working in those frontline industries, dining industry, the theater industry. These poor people, they just don't have any capacity to work. I'm hopeful that the government is going to come up with a program that will get them through. We all want them back, but we need to stop this virus. There's a couple of things we know. One is that there have been people who have gotten COVID a second time, which suggests that it may not last for a very long time. All of those people who've gotten it a second time have gotten it more than 3 months after their first infection. So that's a signal that maybe the immunity at least lasts 6 months. As part of the Moderna study, a subgroup was looked at for antibodies to the spike protein, and they were found that they had substantial numbers, even out as far as close to 4 months. And those numbers were higher than a separate group of patients who had had previous COVID. So it looks like you have substantial antibodies from the vaccine for at least 4 months. Not only that, but it's pretty clear that people also develop memory cells, so that even if your antibody levels go down, you may still be immune. So there is potential that this could last for a considerable amount of time. It's also possible it may need to be given on a yearly basis. We just don't know. What we do know is the vaccine gives a very strong immune response. That immune response probably lasts at least 4 months in the average person. And also importantly, although the antibody levels were higher in younger people, even in the older people that got the vaccine, they were higher than the average numbers in patients who had actually had the infection. So this vaccine, the Moderna vaccine, which is probably very similar to the Pfizer vaccine in its efficacy, appears to be really good. So there is a lot of concern out there about whether people who are immune compromised should get this vaccine. I feel that in most cases when you worry about immune compromised patients getting vaccines, it has to do with the live vaccine. One of the vaccines I talked about before, that's an attenuated virus. And there's concern that that attenuated virus might not be so attenuated if your immune system is bad. That isn't really a concern with this vaccine because we're not giving virus. We're just giving RNA, and our own cells are manufacturing that protein. So I think from a safety point of view, we can feel reasonably well assured that being immune compromised is not going to make the virus more dangerous for you. The one thing that we don't know, and is certainly a possibility, is that immune compromised patients may not mount as much of an immune response to the virus or to the vaccine as somebody who has a normal immune system. That we have to wait and see, but in my mind, that's not an argument against getting the vaccine, since I believe it will be as safe in somebody who is immune compromised as somebody who is not, but we don't know whether it will be as protective. This is only going to work if enough of us do it. And eventually, if only 50% of the people get the vaccine, we will get to herd immunity. But just think about how many people are going to have to die to have that other 20% of the population, to get us up to 70%, have antibodies.
We're so close right now, the vaccine. We have one of them that's available, another one that will likely be available in a few weeks. We're so close. We just need to be vigilant for another 3 to 4 months to get as many people in this state, in this country, vaccinated as possible. If we can just hang in there, wear our masks, listen to the social distancing, pay attention to the regulations that the governor is putting out for us, we can get through this. I feel like we're seeing light at the end of the tunnel, and we just have to hang in there for a little while longer to get through this.